Hi, my name is Kiera Waters, and in this video, I'm going to demonstrate how I would do trach suctioning. So the first thing I would do is I would check my orders and verify, make sure I have the correct orders to do the skill, as well as making sure I have the right patient. Once I see my orders are correct, then I am going to gather my supplies, which I have here, and then I'm going to go and identify myself. Hi, my name is Kiera. I'm just here to suction out your trach. And if you don't mind stating your name and date of birth for me. Patient has stated the name of date of birth, and I have verified with the armband. Next, I am going to wash my hands. Once I have washed my hands, if you have any allergies, patient says he has no allergies, I am going to position my patient in the right position, either semi-fallows or fallows, depending on what's appropriate. And I'm going to turn on my oxygen machine as well, or my suctioning machine as well. From there, I'm going to make sure my hands are clean, and then I am going to don on my PPE, which includes my gown, my mask, and now I am going to open my kit. Once my kit is open, I'm gonna grab my small basin. I'm gonna grab my sterile solution, and if it was new, I would just date it and pour in some into the container. But if it was used already, I would check the expiration and I would lips it and then pour some in. Okay, once that is done, I'm going to grab now I'm going to put my clothes on. Okay. Once my gloves are on, I am going to take my cap off. And then I will use I'm going to connect my suctioning. Once my suctioning is connected, then I am going to place it into my contents, sterile content. Switch it around, make sure it's nice and well coated. Do it intermittently, suctioning to make sure it's in there. I'm gonna allow that to sit. Once that is done, I'm going to hyperoxygenate my patient, allow them to take 5 to 6 breaths, or depending if I'm using a resuscitation bag, I will do that. Once my patient has been hyperoxygenated, I will remove the oxygen source. I am going to take my catheter and now I am going to, without having my finger on it, I am going to advance my catheter about 4 to 5 inches, or until I feel resistance and my patient starts coughing. Once I have reached my mark, then I am going to twist and and intermittently suction for at least about 10 seconds. Alright, once that is done, I can now allow my patient to cough and deep breathe, and I am going to get my stethoscope and listen for any adventitious sounds. Once, if I hear something and it still feel like there's some secretion still there, then I will do it again, only doing 2 passes, making sure it's intermittently for 10 seconds, and then I would advance my cath. Well, I would suction. Once it's nice to suction, then I would advance my catheter in. Once my catheter's in, I would twist, intermittently suction again for 10 seconds. Once that is done, then I am going to once again allow my patients to cough and deep breathe. I'm going to turn off my suctioning. I'm going to oxygenate my patient again. I am going to dispose of my gloves as well as my catheter. I'm gonna wash my hands, gonna put on a pair of clean gloves, and I'm gonna reassess my patient again, just making sure to listen to my patient, listen for any adventitious sounds, and then once that is done, I'm going to take my gloves off, dispose of them, wash my hands, and document in my chart the procedure, my assessment on my patient and how the patient responded to the trach suction.